Assalamu alaikum guys, welcome back to my YouTube channel. So today we are going to discuss about amblyopia. It is a very important topic since it is one of the leading cause of blindness in children, and most of the parents don't know about it, and they tend to ignore this if their child is having any problem in their vision, because obviously they are not to be blamed because they themselves don't know about it, and very preventable blindness, it can be saved. But since they have no idea about it, so it is very important to talk about this topic today. And we are going to discuss about first we are going to define amblyopia, and then we are going to discuss the causes and the treatment of this. So amblyopia, also known as lazy eye, it is unilateral or rarely bilateral decrease in the best corrected visual acuity of the eye, for which there is no identifiable organic cause in the eye or visual pathway. Now what that means is that the eye, the anatomical structure, everything is fine, there is no visible defect in the eye, but the connection of the eye with the brain, the communication is not developed. See, as the child grows up, from birth till 7 years of age, now this age group is very important, because in this age group the visual pathway with the brain at the posterior lobe, the occipital lobe, it is being developed. So during this period it is very important that the child, the vision is properly developed with the brain, and the communication of the eyes with each other, it should be developed. So in amblyopia, this communication with the brain is not developed. Now remember, from birth to 7 years of age, this is the important time period in which this communication is being developed. So in this time period you should be very cautious for your child, that you need to pick this up if God forbid your child has this problem. Now remember, amblyopia is a static process. That means it doesn't deteriorate with time. It's static, it remains the same. And remember, there is no total, there's no light perception or just light perception in these patients. I mean, they can perceive light, okay? So if someone is having no light perception at all, or they are having just light perception, now that's not amblyopia. Amblyopia can see, but the vision is so deteriorated because of the miscommunication, the misalignment with the brain. So this is what these patients are suffering from. So let's come to the causes of amblyopia. So there are 3 causes of amblyopia. The first one is strabismic amblyopia. Strabismus is the misalignment of visual axis of the eyes. So when, let's say, one eye is deviated inwards and the other one is okay, so the brain perceives 2 images at once. So the brain will try to suppress that image which is more, let's say, you can say, out of the path or out of the course, and try to focus on that image which is more aligned, or that image which is more accurate. So in this case, strabismic amblyopia, their cause is the misalignment of any eye, esotropia, exotropia. Esotropia is the inward deviation of the eye, the exotropic is the outward deviation of the eye. So whatever it is, the brain will try to suppress that image of that eye which is deviated. And for this we can opt for surgery, obviously, for the eye which is deviated, and accordingly we adjust the extraocular muscles. That's another topic, we'll discuss this again. So then the eye, the focus is that you need to correct the misaligned eye, so that the both eye can perceive equally the image, and the image formed on the retina and the brain, it should be equal from both the eyes. Now let's come to refractive amblyopia. This is the second cause of amblyopia. Now in refractive amblyopia there are 2 types. Anisometropia. Metropia means refractive error, iso means equal, an means unequal. So anisometropia means the unequal refractive error of the eyes. That means both eyes' refractive powers are different. One eye is transmitting at one power, the second is transmitting at another power. So the brain again is getting 2 images, and will try to suppress that one which is more, let's say, more out of the context, or which is more unclear. So let's come to the second type of refractive error amblyopia. The second type is isometropic amblyopia. So now in this one, both eyes have equal but high refractive error power. So in this one again, the blurred image is being formed in the retina, and the brain is perceiving a very blurred image. So again the brain will try to suppress that image which is has too much refractive power, and it is unclear. Now let's come to the third cause, the last one, that is no image or decreased visual formation. Now as the name suggests, the light rays are not being passed to the retina and to the brain, so it can be due to, let's say, ptosis. Now ptosis is the drooping of the eyelid. Now when the eyelid is drooping, then that covers your eyes and the pupil, so the light rays cannot be passed, and one eye is completely occluded, you can say, and the brain is perceiving image only from one eye in this case. So again, the brain will try to suppress that affected eye. Another cause, cataract. Now cataract, again, it is the opacification of lens. Light rays cannot pass through, image cannot be formed, and the brain will try to suppress this image formed from this eye again. Now, having discussed the causes, what can be the treatment of this disease? The treatment is a bit worrisome for the parents, since the child are not so cooperative. You can't make them understand at this young age, and the treatment is that you need to patch the correct eye, the eye which has normal vision, so that the affected eye is used more and it develops a communication with the brain with time, and it is very successful if detected at an early age, let's say 2, 3, 4 years of age, but it should be below 7 or 8 years of age, because in this time period the pathway is being developed, the communication with the brain is being developed. So you need to detect it at an early age. And so this patching, it should be done about 2 hours in 24 hours. Obviously it is the children, they're not so cooperative, so it is a bit worrisome for the parents, but again, it's the betterment for their children, so they have to try their best with this one. Now another step we can do is penalization of the normal eye. So what we do in this one is that the normal eye, we put atropine drops in that, and the vision in that eye is blurred again, so that the affected eye is being used more, so it develops a communication with the visual cortex. In this penalization, it is relatively used in mild amblyopia. I hope this might have cleared your concept on the topic of amblyopia. So now you know why is it called lazy eye, as there's no organic cause, but the eye somehow fails to transmit this visual signal to the visual cortex. So this is a very important topic, and most of the parents tend to ignore this in their children, and most of the parents are unaware of this, and lots of children worldwide develop blindness because of this one. So make sure next time you have any relative or anyone at home, be cautious of this disease. Until my next video guys, take care.